Hi everybody, my name's Mark Street. I'm from Brisbane, Australia. I was first diagnosed with granulomatosis with polyangiitis in 2016. Thanks for taking my question, Dr. Warrington. I'd like to know if there's anything that my doctor or I can do to avoid a relapse. Are there lifestyle or dietary changes that can help the odds of not having a relapse?
Yes, and of course, a topic that's of great interest to us and to our patients. And I think almost every patient that I interact with asks that question. And and of course, my first answer was, I wish I had more knowledge um, to provide to answer that question, in a meaningful way. I would say one of the best ways to avoid relapse is medication, and the tricky part is we don't have clear answers as to how long individuals should be on medication. So there's no doubt we need better blood tests or parameters or tests to understand and to be able to calculate and predict somebody's risk, right? So there are a few things that we know. I mentioned, for example, when we think about patients who have a positive PR3 versus an MPO, we know that people who have a positive PR3 have a slightly higher risk of relapse. We know that if the ANCA test remains persistently positive, that might be a risk for relapse. But these are all relative risks. They give us some idea, but for an individual person, they really don't tell us if and when that person is going to have a relapse. So should the treatment go on for 2 years or 3 years or 4 years? We just don't have that answer yet. So early on, certainly within the first few years from the diagnosis, the best way to avoid a relapse is to be on medications to prevent the relapse. And then working with the provider on an individual basis to understand what are the risks of continuing treatment versus the risks of stopping the treatment. And we have ways to go, in terms of learning that and understanding that. Patients often ask me, would it help if I were to change my diet, or if I were to change my activity level, or if I were to change something else, that I'm doing at home to change my risk of relapse? And the honest answer is, right now we don't have any data to suggest that a change in health patterns or lifestyle or diet can avoid a relapse. Of course, we recommend that patients exercise regularly and eat a healthy diet and so forth, for many reasons that are obvious both to patients with vasculitis and to patients without. But we're not there yet. We're not there in terms of finding a non-medication strategy to help avoid or reduce the risk of relapse. And and again, with things like avacopan, there'll be more interest and understanding, can we avoid the use of prednisone, for example? I think, of course, we want to be in control, like in many circumstances in life. And we think about, what did I do before this relapse happened? And was it this or was it that? There are a few things. For example, one of the things that I counsel my patients about is smoking, tobacco use. And, and there is some research in vasculitis. Of course, vasculitis is diseases of the blood vessels. And we know, for example, that smoking is an irritant and can damage blood vessels. So that's one thing that, if an individual smokes or uses smokeless tobacco, it would be one thing that we would want to avoid. And exactly as you said, Kathy, we want to stay healthy, and with diet and exercise, we can prevent things like, for example, diabetes and high blood pressure. And so there are things that are within our control that we can work on.